Hello, I'm Dr. Min Cha-hyun. Today I'm gonna do the radiograph of the lumbar spine. Let's take a brief look at what kinds of diagnostic images are. Among them, let's look at how X-ray images are depicted, how they are assessed and read. Then check the anatomy of the lumbar spine. Let's see how to take an X-ray and what is the normal X-ray image of the lumbar region. Finally, let's take a look at some of the lumbar spine measurement. In the clinic, doctor does several tests and make a diagnosis. To confirm the diagnosis, we could take diagnostic imaging, blood test, urine test, and so on. What kind of test will you do? So, in the beginning of this lecture, let's think about the type of diagnostic images. Computed tomography, so-called CT scan, makes use of computer-processed combination of many X-ray measurements taken from different angles to produce cross-sectional images of specific area of a scanned object, allowing the user to see inside the object without cutting. CT scan is referred to as multiplanar reformatted imaging by using X-ray. Magnetic resonance imaging is referred to as multiplanar reformatted imaging too, but MRI does not involve X-ray and the use of ionizing radiation, which distinguishes it from CT scan. And MRI is useful for examining soft tissue. X-ray imaging is a basic examination and shows the three-dimensional structure in 2 dimensions. For the X-ray imaging, clinicians and radiologists know anatomy, physics, morbidity, economics, advantage and disadvantage, particular clinical problem being investigated. So we must know at least anatomy, radiographic positioning, and clinical radiology pathologies. X-ray images are depicted as grayscales. There are gas, fat, water, bone, metal in the bottle. It looks darker or lighter, depending on the density of the object. The X-ray penetrates well, it's called radiolucent, and it looks more darker. How would you assess if the patient had taken an X-ray to confirm the diagnosis? In the image, we should check patient information and positional marking. Then we could check color, location, shape of the region for clinical radiology pathologies. Once you get used to seeing normal X-rays, you will learn more about regions. How about reading an X-ray imaging? Read it according to A, B, C, S abbreviation. A means alignment of skeletal structure. B means bone. In the bones, we could check cortex, medullary canal, trabecular pattern, size, shape, density. According to the Wolff's law, density of the bones vary even under the same condition. It will be an indication of the degenerative change. C means cartilage category. We just know it's the space between bones and bones. S means soft tissue shadow. Soft tissue can be identified by changes in the radiation exposure conditions. X-ray shows the three-dimensional structure in two-dimensional image. To understand the image, we need to know the three-dimensional structure. This is the lateral view of the lumbar spine, anterior body, posterior compartment, and between them there's pedicle, and superior articular process and inferior articular process. Between them there's pars interarticularis. Right side, this is the superior view of the lumbar spine. This picture, body rotate to the left a little. We can see anterior body and all of posterior compartment. Between them, there's a pedicle too. Transverse process, spinous process, mamellar process, and superior inferior articular process, and between them pars interarticularis there. This cartoon is good for division posterior compartment. On the right side picture, transverse process and spinous process. Between there's a lamina, and superior and inferior articular process. Between there's pars interarticularis. X-ray is not a picture, so we must know the image of superimposed structure. That's why we should get used to normal X-ray first. In the P to A and A to P, pedicle shadow looks like eyes. In the lateral view, we can see the pedicle directly. Between upper and lower pedicle, called vertebral lodge, it consists intervertebral foramen. In the oblique view, we can see the zygoapophyseal joint. There's a scattered sign. Superior articular process is ear of the dog. Inferior articular process is leg of dog. Between them, leg of the dog is pars interarticularis. Anti-transverse process is nose of dog, and pedicle is eye of dog. Today we will do positioning the three views we saw above: lumbar AP, lumbar lateral, lumbar oblique. In lumbar anterior to posterior positioning, it should be included thoracic spine 12 to sacrum. Patient is standing position for weight bearing and posture analysis. Central lay is 1.5 inches below the iliac crest. If it is real patient image, it should have patient information. This is the right side. We must know the name of structure in normal. There's rib, 12 thoracic spine, and 1, 2, 3, 4, 5 lumbar spine. And transverse process of L5, L4 body, L4 spinous process, L3 right inferior auricular process, and L4 left superior auricular process. And F is 1, 2 between intervertebral disc space. In lumbar lateral position, patient is standing. Include 12th thoracic spine to 5th lumbar spine. The forearms are brought forward comfortably so that they do not overlap. Central lay is between ASIS and PSIS, 1 inch above iliac crest. In lumbar lateral view, first we should know the normal structure, then we can read according to A, B, C, S, alignment, bone, cartilage, soft tissue. We can get lots of information. In lumbar oblique position is good for zygomatic joints, so-called corridor. Patient is semi-prone with the body rotated 45 degrees. Anterior oblique is for opposite side of zygomatic joint. Posterior oblique is for same side of zygomatic joint. Central lay is 1 inch lateral to L3. Spinous process in anterior oblique, 2 inches medial to 1 inch above iliac crest in posterior oblique. This cartoon and picture are well described in the oblique view. RPU positioning is good for right side zygomatic joint. Posterior oblique position is the same side. RAU positioning is good left side zygomatic joint. Anterior oblique position is the opposite side. For normal oblique view, we should take X-ray both sides each. Superior articular process is ear of the dog. Inferior articular process is leg of dog. Transverse process is nose, and pedicle is eyes of the dog, and pars interarticularis is neck of the dog. There are many of alignment and measurement of the lumbar spine. Today, let's see Meyerding's grading method in spondylolisthesis. Spondylolisthesis is the slippage or displacement of the vertebra compared to another. In these images, superior surface of the first sacral segment is divided onto 4 equal divisions. The relative position of the posterior inferior corner of the L5 body to these segments is then made. If the vertebral body has completely slipped beyond the sacral promontory, the condition is called spondylostosis. Thank you. I hope to see you again.